My name is Julia Heidi Antonio, but you can call me Julie. I'm 39 years old. I love cooking, I love K-pop, and I love Korean dramas. There are so many things that I like being a nurse, and one of them is that feeling when you were able to help your patient relieve from their pain, from their suffering, from the disease. I think that is what really I like, or what really inspires me to become a good nurse. Let's include my volunteer years. I think it is around 6 to 7 years. Okay, this is actually a very long story on how I become a nurse. Actually, nursing is not my first course. It is communication arts. But my mom, who is currently residing in the US also that time, and nursing is so in demand, she actually forced me to take nursing. So I told her, okay, I will take nursing, but if I really don't like it, then I'm going to stop. But on my 3rd year, I remember I have this patient. I took care of this patient, and she was so happy, so appreciative of me, and that feeling, it never goes away. It stays with me, and it actually inspired me to really pursue nursing and become a real nurse. And that was on my 3rd year. I think I was around 23 or 24 years old. So yeah, the age that I decided, it's I think at 23, 24 years old. That's when I decided to become a real nurse. Okay, when I was still a student, I already wanted to become a dialysis nurse. Why? Because I want to help my patients to live their life as normal as possible, and also to prolong their life. That is really what I wanted. That's why I choose to become a dialysis nurse. And also, if not dialysis nurse, I also wanted to be a geriatric nurse, because I want to help those elderly patients to live their life to the fullest and help them function as normal as possible. So it is dialysis nurse and geriatric nurse that I wanted to be if I could choose a specialty. As a dialysis nurse, since I'm working as a dialysis nurse now, what I don't like, or what is the most difficult, is the emotional attachment. We always see the patient weekly, 2 times a week, 3 times a week. So we became close to them. We treat them as family, and we know how chronic kidney disease is. So once something bad happens with them, we also get hurt, and that is the most difficult part of this job, the emotional attachment. Stress is part of this job. As a nurse, this is very stressful because we do handle lives of other people. But me personally, how I handle stress in my work, I eat. I eat all the foods that will make me happy. That really relieves my stress. Eating. I do stress eating actually. So yeah, and also when I'm stressed, whatever happens in work just stays in work. So when I go home, just forget about it and just eat. Well, I should say first, as a dialysis nurse, just seeing my patient live their life as a normal, like a normal person, that is already rewarding to us. And also, I also experienced working in a ward, medical ward, surgical ward, pediatric ward. Also worked there as a volunteer. Just seeing them being discharged, they're appreciative of what you did to them, I think that is the most rewarding part of this job. Okay, I become very happy every time I see my patient listen to me, listen to my advice, and whenever they treat me as family. Actually, that really makes me very happy with this job. Okay, actually this advice, I also apply it to myself, okay? So to all the nurses, to all the new nurses out there, just don't be just a nurse in title. Be a nurse in your heart, in your mind, and in your soul, because this job is not like any other job. This job, we need to be compassionate because we handle people's lives. So we need to give the right amount of care to a patient. So don't be just a nurse, be the nurse.